This is perhaps for all the parents joining us this morning. The South African Paediatric Association welcoming the approval of the Pfizer COVID-19 vaccine for children over the age of 12. So we're talking about the youngsters here. The South African Health Products Regulatory Authority says the decision was based on a review of updated safety and efficacy information. Well, let's talk a little bit more about this. Vice President of the South African Paediatric Association, Dr. Despina Demopoulos, joining us this morning. Good to have you with us. Doctor, let's talk about the 12-year-olds, if we can. I'm sure some parents going, not a chance, not getting the COVID-19 vaccine. They're too young. What do you say to that?
So children have been getting vaccines throughout their lives, as you've mentioned earlier on. So from the time that they're 6 weeks and from the time of birth, they've been getting vaccines. And this has been going on for ages, and there's a lot of science to prove how these vaccines have saved people's lives and have actually stopped outbreaks in the past. So 12 years old, yes, it's younger than the adult population, but vaccines are not given to children unless they've actually been tested on adults. And so all the data will be safe for our children because they've been tested on adults, and trials are currently being done for children. So 12 might be younger than the average adult, okay, but not as young as the little babies that are getting the vaccines. And 12 is also the age when children can actually really start getting sick from COVID. So I don't feel, and the South African Paediatric Association does not feel, that 12 is too young for children to be getting the vaccines.
And I'm glad you brought this up because you made a very good point. We were all getting vaccines much younger than that. Friends of ours just had a little one a while ago, and she's been going for jabs every couple of weeks, every couple of months. I forget what she goes for. So vaccines aren't anything new for youngsters. But tell me, Doctor, for the COVID-19 vaccine, is it the same size dosage? I mean, they're quite a bit smaller than, for example, what I am.
Yes. So there are studies that are currently being done in terms of the dosage that needs to be done, whether or not it's one jab or two jabs. Do they need boosters? And that's, I mean, we've been doing stuff from March this year, especially in the transplant population. That's children that have received solid organ transplants. And also they have been receiving vaccines overseas in many places. So we haven't finalized exactly whether or not it's one or two doses. Okay, but the jabs are the same jabs, so it's Pfizer. We're not giving the other, like the J&J, to the kids because the studies are mainly on Pfizer, and now they're on Sinovac. So it might be half the dose. Okay, there are still studies being done on that, but we've even shown with one jab overseas that it's making a huge difference for the children.
I'm curious about side effects. I mean, some people experience no side effects whatsoever, perhaps just a slightly sore shoulder. That's all I had. I had no side effects at all. Could the side effects be more severe in youngsters as young as 12?
So there will always be side effects. I think there's nothing in medicine that doesn't have side effects. Even the Panado that you pop for a headache has got side effects. And yes, the jab does have quite a bit of side effects for some people. Myself, I was in bed for 2 days when I got the J&J, but then fully recovered afterwards. So we found that in the older people, the side effects are a little bit less. So there is a chance that with the younger kids, it might be a little bit more. But our children bounce back from everything. We've had children have side effects from the measles vaccine, from the MMR. Within a day or two, they're actually fine. The side effects definitely are not as bad as actually having COVID or a multi-inflammatory syndrome that develops in our children from COVID. So nothing like that.
Well, I think you put a lot of parents at peace this morning. Doctor, I really appreciate you taking time to come speak to us from the SA Paediatric Association, Dr. Despina Demopoulos. So vaccines for kids is normal. Side effects for vaccines is normal, even for the young 12-year-olds.